अस्सलाम वालेकुम इय्याका नअब्दु व इय्याका नस्तईन। वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज मैं इसके 17 सीरीज़ का मेडिसन पोर्शन का ये लास्ट पेपर है वो मैं करने जा रहा हूँ। मेडिसन 23 नवंबर आफ्टरनून। तो लेट्स स्टार्ट। क्वेश्चन नंबर 1, द मिनिमल चेन डिजीज़ फीचर इज़ द प्रोटीनूरिया 3.5 mg/dL. Question number 2, internal hemostasis is maintained by the release of endocrine glands. Question number 3, the inferior epigastric artery lateral to which hernia, that is a direct hernia. Question number 4, the drug of choice of status epilepsy is which of the following, that is lorazepam. Question number 5, the patient came in the ER with a chest pain, ECG normal, cardiac enzymes normal, doctor advised thoracic cage, X-ray, which one of the following structure is cartilaginous plus amphiarthrous joint, that is the costochondral. Next, question number 6, the cardiac defect in the fetus of the mother suffering from the rubella infection will occur in which time, that is the 5th to 10th week. Question number 7, the fatty diet increases which of these, that is CCK. Question number 8, after salpingo-oophorectomy for recurrence of the tumor, which marker is used, that is CA125. Question number 9, the 53-year-old patient had non-purulent cough for the 2 months, non-smoker, now presented with the blood streak sputum. Left lung has 5 cm hyalomass. Sputum shows the hyperchromatic pleomorphic cells with scanty cytoplasm. The cause of this condition would be the radon exposure. Question number 10, the fisherman presents with the complaint of the weakness and early fatigue. He used to have only fish and rice in his diet. HP7 MCV 105, what could be the likely cause, that is the macrocytic anemia. 11, the chronic liver disease will have the decreased albumin. 12, the mineral of the bone is the hydroxyapatite. 13, the Ashkoff body's generation initially stage is which of the following, that is the fibroid degeneration. Question number 14, the leukocyte alkaline phosphatase activity decreased in the CML. Next, question number 15, the side effect of the anti-hyperlipidemia is GI disturbance. Drug not given, the myasthenia gravis is the gentamicin. The patient is known case of CKD. Which drug is contraindicated to be used in this patient? Gentamicin. Longest pro-erythrocytic phase is which of the following, that is P. malaria, plasmodium malaria. Next, 19, the patient presented with the Crohn's disease. For her treatment of remission, corticosteroids are given. Which is the best for the maintenance of the remission of this disease, that is azathioprine. Next, 20, the most common cause of inherited intellectual disability will be the Fragile X syndrome. Question number 21, a blood group can get blood from the A positive and the O negative after hemorrhage. Which part mostly affected is the proximal convoluted tubules. 23, the muscle of abduction of the hip is the gluteus medius and the minimus. Patient has LRTA for many days on histology of the respiratory, which the following will be damaged, that is the cilia. Highest alkaline pH is present in the pancreatic secretion. The association of IgA nephropathy is which kind of deposits, that is mesangial deposits. Next, 27, the full stretching of the muscle is done which of the following prevent the muscle tear, that is the Golgi tendon. 28, the sympathetic cholinergic discharge occurs in the sweat glands. The boy walking barefoot, pointed object pinches his plantar surface, he withdraws suddenly. Receptors involved will be the free nerve endings. 30, the patient with the short stature and the web neck, lymphedema. Chromosomes sequence will be 45X nullo. 31, the C ANCA is positive in which of the following, that is vasculitis. Hypokalemia leads to which effect on the heart, diastolic arrest. Question number 33, the person with the hypertension and the bradycardia, which one of the following is present along with its raised ICP. 34, the organ that regenerates on its own is liver. 35, the antibodies are produced in exophthalmos which is due to TSI. 36, the benign tumor among the given would be the Warthin's tumor. 37, the melanoma invade orbital cavity through which of the following, the measure veins. 38, the patient with the ptosis and the mydriasis and the eyeball laterally rotated, likely due to the damage of the oculomotor nerve. Next, question number 39, what is more in the dialysis fluid compared to the plasma, that is bicarbonate. 40, the least renal clearance is of beta glucose. 41, no action potential occur in hyponatremia. 42, the pararenal fat is an extension of the renal fascia. 43, the fetal brain development is by the thyroid hormone. 44, the British woman went to Thailand and presented the fever rigor chills, is most likely suffering from the malaria. The sulfonamide mechanism of action is inhibited sensitive folic acid. Group of the friend went to restaurant and eat chicken and fresh fried rice. At midnight, value food poisoning, the causative agent, the Bacillus series, which food is responsible? That is the fried rice. Subclass of the myosin in the cardiac muscle is the both alpha and the beta. The patient with abdominal pain and the persistent vomiting cause would be the enterotoxin. The cervical pap smear shows the two-third epithelium has a typical disorganized cells with the loss of the polarity, high C ratio, and the pleomorphism. That is the moderate dysplasia. Next, 50. The plasma cells are produced by which of the following? The beta cells. The talcum granules produced by the actinomycetes. Sulfur granules containing bacteria would be the actinomycetes. The patient was taking warfarin, and after monitoring INR 2 to 3 is in the normal range. But then patient took another drug for the chest infection due to which INR increased to 5. What is that? That is the clarithromycin. Woman after hysterectomy for the benign ovarian cyst came with the fever, pneumonia, and the BP 80-60 gram negative dots were identified. She goes back from the shock. What is the mechanism of the shock? That is a septic shock. Next, the patient went through cystoscopy to the hematuria, later developed fever and hypotension. Cause of the hypotension would be the sepsis. A 30-year-old man sustains a left femoral fracture in a skiing accident, and his leg is placed in the plaster cast. After the leg has been immobilized for several weeks, the diameter of the left calf has decreased. This change is most likely to result from which of the following alteration? The calf muscles, that is the decreased workload. 57. The biopsy of the stomach done. There was no non-specialized gastric tissue in the scattered goblet cell. This is related to the metaplasia, which is anterior to the root of the lung, that is the phrenic nerve. Next, 59. The regarding autosomal recessive, 1/4 children affected. A girl presented to her physician with concern. Both her mother and the sister died of the metastatic breast cancer for 40. She is worried about herself. Which of the following gene is mutated? That is the BRCA1. For transplant, best cell for HLA typing is the white blood cell. A lady suffering from the CA breast undergoes total mastectomy, developed edema of the right lower limb. Which of the following can be the reason of this edema? The lymphatic obstruction. The tumor suppressor gene involve the renal and the gonadal agenesis, the WT1. Which one is the most antigenic? That is the streptokinase. The triple assessment for the congenital fetal anomalies include which of the following? That is the estriol E3. 66. Which the type of hypersensitivity? The SLE would be the type 3. The patient have one normal baby, but she is Rh positive and the baby is negative. In second pregnancy, the preterm baby born in 33 weeks and on the ventilator. What type of antibodies baby have? That is a complement mediated. Next, 68. The after accident change in the behavior, aggression, lost job due to the damage of prefrontal cortex. 69. Low concentration epinephrine from the medulla cause the vasodilation via the beta 2 adrenergics. The regarding internal jugular vein that starts from the ear lobule to the sternoclavicular joint. 71. The patient has the internal jugular lymph node biopsy in the neck region. After that, he developed the numbness of the ear lobe. Which of the following nerve got injured? That is the greatoauricular nerve. 72. The neck veins normally don't distend. They distend when the right atrial pressure rises above the 8 plus. Right side is the spinal cord hemisection cause which of the following defect? The ipsilateral upper motor neuron lesions. Next, 74. The regarding warmth receptors, alpha large receptive field. 75. The patient with the epistaxis maturia, saddle nose, and the granulomatous inflammation. Diagnosis would be the granulomatosis with the polyangiitis. Cause of the petechial hemorrhage less than 2 mm is delta, that is the thrombocytopenia. 77. SP in the lower dose inhibit which of the following inhibit thromboxane A2. Next, 78. The aspirin and other enzymes work by acting on beta cyclooxygenase. Next, 79. Association of HLA beta B5 would be the Packett's disease. HLA B27 is associated with the Reiter's syndrome. Next, the derivatives of the first pharyngeal arch are the mylohyoid. 82. First cervical nerve supply is the genohyoid. The patient with the fragile blood vessel with the gums inflamed and the bleeding, likely diagnosis would be the scurvy. The trachea is descending in the superior mediastinum, which structure runs to its right side, that is the vagus nerve. 85. The patient is suffering from the dysphagia, dysadia, analgesia, and the thermoanesthesia on ipsilateral side of the face and ipsilateral Horner syndrome. Occlusion of which the following artery would produce these signs and symptoms? The posterior inferior cerebral artery, PICA. Next, the 86. Regarding the cilia consists of 9 doubles, microtubules plus 2 singles. 87. The married man had no children for a few years and was diagnosed with the sterile with the isospermia. What is the investigation of the choice? That is the serum FSH and the serum LH. Next, the patient cannot recognize the things touching body with the closed eyes. Leon is at the DCML track. The CRF, which of the following occurs? That is the plasma participation from site tends to be low. The patient with the transmural infarct died on 9th day. Cause would be the pericardial tamponade. Slow breathing movement is called athetosis. Next, the patient after RTA has the BP of 80 and the heart rate of 45. What drug should be given to increase the heart rate? That is atropine. Due to the stress of surgery, what will increase and cause the vasoconstriction? Catecholamine means a loud S1, opening snap, and the mid-diastolic murmur, apex, that is definitely the mitral stenosis. Next 95, after forced expiration, residual volume is 1200 ml. Lung compliance is increased in which of the following? There is old age. Regarding the bronchial asthma, the most probable finding would be delta, which is the FEV into FVC ratio less than 75%. The triceps reflux loss lesion is in the lower cervical. The auditory loss pathway involved would be the olivocerebellum tract. Middle branch of the ECA, external carotid artery, would be the ascending pharyngeal artery. The sympathetic beta adrenergic leads to which of the following? The decreased airway resistance. The ratty ridges associated with the verrucous carcinoma CA. In old age, cardiomyopathy related to the calcium influx. Next, 104, the patient known case of hypertension and has a stroke 1 year back with the vision loss. Now his stroke and the vision is improving. Actively he had the complaint of the left homonymous heminopia with the left hemi spatial neglect. Which part of the brain is affected? That is the right parietal cortex. Increase heart metabolism and the sets of vasodilator effect would be the increased heart rate and the contractility. 106, antidepressant causing the increased calcium would be the fluoxetine. 107, the 45-year-old woman having the weight loss, increased T3 T4, decreased TSH, most likely diagnosis with the primary hyperthyroidism. G coupled phospholipase C will lead to increase in the calcium. Which of the following supply the supra renal gland? That would be the alpha, which is the greatest splanchnic nerve. Next type of the necrosis in the pancreatitis is the fatty necrosis. Axillary sheath continuation of which fascia? That is the prevertebral fascia. The 48 years old lady at last stage of the CA fibroid, and she tells you not to tell her family. Her son asks about her mother condition disease. What will you do? Tell nothing. Third, heart sound produced by the rapid inflow. Next, 114, the acute bacterial meningitis case with the typical picture of increased proteins and neutrophils more than the lymphocytes. He was having the rash around the ankles and signs of meningeal irritation on the basis of the Gram stain. Doctor started the IV ceftriaxone, but the results on the Gram stain, that is the Gram-negative diplococci. 115, the slow waves of the stomach begin from the interstitial cells of the cajal. Patient has the emphysema. What will be the acid base imbalance present in him? That is the raise in the plasma participation of the carbon side transporters, mainly in the form of bicarbonate. The flood having the specific gravity of 1.006 cause would be the CCF. The deep and the interior structure to the in the popliteal fossa is the popliteal artery. Greatest blood flow per 100 gram of the tissue is the kidneys. Next, 1 to 1, the during exercise the blood flow remains unchanged due to the brain drug of choice for the trichomonas is the myronidazole. If alveolar ventilation doubles and the carbon dioxide production remain the constant, then arterial participation of carbon dioxide is halved. Total iron content in adult female is the 2 gram. The female with the severe abdominal pain diagnosed as an acute biliary colic given morphine as analgesic. What additional drug beside the morphine will provide the good analgesic relief? That is the hyoscine butyl bromide. Next, 1 to 6, the patient has the very tender swelling with the yellow discharge. Which cells will be seen? That is the neutrophils. A narrow spot in the pediatric airway is the cricoid. Stab wound at the left fifth intercostal space just lateral to the sternum. Structure damage would be the pericardium. The nasal granule present in the granular endoplasmic reticulum. A young man has the liver enlargement and splenomegaly. ALT is 256, AST is 300. Serum celloplasmin was low. What finding will you see in this patient? There is the cause of flash rings. The perforation of the posterior wall of the duodenum. Which artery is involved? That is the gastroduodenal artery. Next, 132, the patient has the weakness in the dysphagia, fatigue, and the low HB. MCV 68, and what is the suitable diagnosis? There is iron deficiency anemia. The part of the levator ani that slings around the anus forming angle would be the puborectalis. The fibers of upper motor neuron are decussated in the medulla. Next, patient 135, the patient presented with a severe metabolic occlusis, BP 190 by 110 and the hypokalemia due to the increased aldosterone levels. 136, the 70-year-old man with the renal transplant 2 years back now presented with the complicated pneumonia, not responding to antibiotics. Bronchoalveolar lavage shows the boat shape cyst. The organism causing the condition is the pneumocystis gyrovasi. Regarding the facilitated diffusion and the co-transport, the carrier dependent, the process of long-term memory involves the protein senses. 139, the patient develops the nasal congestion, runny nose, itching every year. In the April on biopsy, nasal mucosa will show the degranulation of mast cells. AV node blood supply by the RCA. 62 years old patient of the congestive heart failure presented the dyspnea orthopnea. Mechanism of pulmonary edema in the case of CHF is which of the following, that is increase vena cava hydrostatic pressure. 142, the old age diabetic patient having the multiple abscesses, sporulative inflammatory cells reach inflammation area by the post capillary venules. 143, the student examining a slide visualize the tumor of muscle of GIT. The patient which connect cells together is missing. The protein is the fibronectin, the floor of the acetabular fossa found by the ischium and the pubis. In the Kawashiko, there is protein deficiency. 10 years boy came in the OPD with the injured anatomical snuff box. Lesion of which of the following occurs is the radial artery. Next, 147, the gluconeogenesis occurred due to the decrease in the insulin in a plasma flow measured by the pH paramonohyparic acid. Drug contraindicating the CLD would be the pentazocine. The apoptosis is induced by the activation of the caspases. 500 patients exposed to smoking versus other subjects or not. Which type of study is this to see the effect? That is the cohort study. The standard deviation measures or the variability among the individual values. Next, 150, the boy continually failing in the exam. He is doing anger to his parents. This type of the defense response is called the displacement. Next, CD means cluster of the differentiation. 155, the woman undergoes abdominal surgery 10 years ago. Now she is diagnosed with SCC thought to caused by the hepatitis B. It is said the DNA and the RNA viruses are oncogenes. Which one of the following is caused by the RNA virus? That is the T cell leukemia causing virus. 156, the student observing histology slide of the slight tumor tubular structure which with thick vascular wall and the pseudostratified epithelium. Most likely the slide is of which structure? That is the vas deferens. 157, the middle-aged man came back from the Cairo, developed the painless hematuria. What is likely diagnosis? The squamous cell carcinoma of the urinary bladder. During pharyngeal swelling, face the transient holding of the breath. The patent lumen of the allantois forms the urachal fistula. 160, which of the following inorganic compound is carcinogenic? That is the asbestos. Next, 161, the structure found 2 feet away from the vesical junction at anti-mesenteric border is most likely the Mcqs diverticulum. Therapeutic index of the drug indicates that is safety. 160, the person presented with the central chest pain for the 4 hours. Which cardiac enzyme will be rate the tropi? Which part of the lung partially filled costodiaphragmatic recess in the move in and out during the inspiration? That is the lingula. The patient presented with the irregular pulse and irregular or interval. Diagnosis would be the A fibrillation, atrial fibrillation. 166, which what should be given to increase vitamin in the diet? That is the green vegetables. The patient is having rhinosinusitis and the nasal polyp with the fungus invading lamina papyracea. Excessive endothelial damage and the having non-separate hyphae. The organism involved would be the mucor. On ECG of the girl, you see a sawtooth wave, definitely atrial flutter. After transplant, immunocompromised patient present the fever, neck rigidity, and the meningeal irritation. Hollow seen around the organism involved in the brain tissue. CSF analysis shows the increased lymphocytes and protein. What is likely cause? That is the Cryptococcus neoformis. Next, 170, the 19-year-old female of the southern origin gives birth at the 35th weeks. Baby slightly hydropic peripheral blood smear shows the nucleated biopsies and some erythrocytes marked cytosis, poikilocytosis, leptocytosis. What is the diagnosis? That is alpha thalassemia. 171, 2 years old child presented in the outpatient department the fever, pallor, and the bowel disturbance. Lab reveals HP 5.6, MC 107, MCH 340, MCH 36. Which investigation confirmed the diagnosis? That intrinsic factor antibodies. 172, myelination of the peripheral nerves in the fetus occur in which month? The 4th month. 173, the excessive opening of the mouth is prevented by the temporal mandibular ligament. The woman was being examined a single 2 centimeter long mass which was covered by the normal intestinal mucosa at the base. Diagnosis is hyperplastic polyp. 175, the total hematocrit in the neonate is 54. Main function of the hepatocytes is detoxification of the ammonia after dark adaptation. What will occur? Improve vision in the peripheral part. After an accident, patient broke his neck and diet of the bony fragment going to spinal cord. The fragment of the bone is derived from which bone, that is axis. The bronchogenic carcinoma involve the deep cervical lymph node, causes wrinkle and atrophy of one side of the tongue. There is a hypoglossal loss of the fingers extension in the abduction after injury to the left elbow due to the damage of the posterior interosseous nerve. Next, 181, the taste sensation pathway goes into thalamus, then lost central gyrus along with the touch. The parathyroid glands are four in number. Two are superior parathyroid glands and two are inferior parathyroid glands. Attached to the posterior part of the thyroid gland, the blood supply to these four glands is by the R4 gland is supplied by the inferior thyroid artery. 183 GFR is made by the inulin in obstructive lung disease, which capacity increase, that is FRC. Enzyme deficient in the von Geiki's disease is the glucose phosphatase. Absorption of the CSF occurs in the arachnoid granulations in a person having regular exercise has the heart rate of 80 beats per minute. Coronavirus were recently named as the SARS-CoV-2. Next, the platelets adherence is facilitated by the rough endothelium. Which of the following drug is actively secreted by the kidneys? The penicillin. The female pregnancy got terminated at 20th week. Now having the nipple discharge after procedure. This is most likely the hyperprolactinoma of the pregnancy. Next, one night the patient had the stroke and now on the Doppler he has increased blood flow. What is the reason for this increase in the cerebral blood flow? There is increased participation of common side. The vasculitis that involves same vessel or the different vessel with the lesion of the different ages is which of these? That is the pain. Next, to avoid from first pass metabolism, drug should be given IV. Which hormone is responsible for the late gastric emptying? That is CCK. LP of the normal patient done with will be the finding of CSF to differentiate from it from the plasma, that is the low glucose. So that's it from this paper. Thank you for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.